Hi, everybody. Happy Valentine's Day. It's Dr. Prabakar from TheFibroidDoc, and I wanted to talk to my people real fast on this Valentine's Day. So, I don't know if it's just me or in general as a society, we've kind of made this shift, but I feel like we've kind of gone away from the flowers and the chocolates and the gifts and the dinners on Valentine's Day to really talking a little bit more about self-care and self-love and taking care of oneself. At least as I browse social media and just, going up and about this week, that's sort of the vibe that I've gotten. I did paint my nails red, but other than that, I think it's been so refreshing to actually see that more people are talking about taking care of themselves. And as an OBGYN, I take care of women, and I see 20 to 24 patients a day. I operate on women every week, and my job is to really get women tuned up health-wise, GYN-wise, so that they can go on to live really robust lives that enable them to feel successful and like they are really living their best life. So in that vein, I wanted to just share 3 things that we can focus on, especially as women, to really take care of ourselves. And I think some of this I may have said in the past, but I think this is so important because when we fill our cups and make sure that we are really tuned up health-wise, then we can go on to live joyful lives and, spill that over onto our kids, our family, our patients, our clients, whoever we meet every day. So firstly, I wanted to talk about abnormal bleeding. So I am the fibroid doc and I deal with fibroids. And so of course I have to say something about bleeding. So, if you think about it, as women, we actually bleed a quarter of our lives. Like, that's insane. Like 1 week out of every month. And if we actually have bleeding problems and abnormal bleeding issues, we're bleeding often a lot more. So 25 to 50% of our lives is spent bleeding. That means we are unable to enjoy all activities that we would otherwise enjoy, make spontaneous travel plans, sometimes be in pain, sometimes have to call out of work, face a reduction in productivity, and just feel, yucky. So the main point I wanted to get across here is bleeding outside your period, which is 4 to 5 days out of the month, is not normal. I just saw 2 patients today actually who said to me, well, my grandmother bled a lot, and well, I'm close to menopause, so and so said that of course this kind of bleeding is normal. Well, it's not normal. So make sure that you see your gynecologist and just talk about your bleeding pattern if it's not normal and get it figured out. Sometimes, it's little things that could be structural. Sometimes it's hormonal. Sometimes it's, your thyroid. But whatever it is, just make sure it's okay and that there's nothing brewing, in there. Hi, Efka MD, thank you. And you don't have to be bleeding abnormally because of fibroids necessarily. So this applies to anybody who's having some abnormal bleeding. And then number 2, prioritize sleep. Okay, so I know there are a lot of things that sleep experts say, right? Like turn off TV, turn off your gadgets, take a warm shower, lower the lights, all of those things like an hour before you go to bed. So say you're trying all of those things, you're really prioritizing your sleep, you're trying to give yourself, the max 7 to 8 hours that's recommended, and still you're not getting enough sleep. You're tossing and turning, your sleep is interrupted, you feel super tired the next day. If things like that are happening, go see your doctor and figure out, why. Maybe you have an underlying sleep disorder. Maybe, you are perimenopausal and you could really, benefit from some hormone therapy there could be, so many things going on. But the good news is often there can be a diagnosis and treatment. So sleep, as we know, is so important for our, functioning. It solidifies, our thoughts and happenings from the day before, and really helps with memory, focus. It's amazing. So make sure that you're prioritizing that and getting enough of it. Now, I'm not a sleep doctor, but my friend is. So you can follow her at Restful Sleep MD on Instagram for all sorts of neat tips and tricks, webinars and all that stuff on sleep. I'm a full-time OBGYN. I have 3 kids, and I sleep 7 to 7.5 hours every single day. I just make sure that, I'm getting that. I don't watch TV in the evening. I actually don't watch TV ever, but I really make sure that I stop whatever I'm doing and like wind down and really make sure I get that sleep. Otherwise, it really affects my productivity and my work the next day. And lastly, I just wanted to go over the main health maintenance things that we as women should be looking out for. So there's a lot of, depending on which doctor you go to, you may hear different recommendations on these things, but I wanted to give you the up-to-date recommendation as per the American College of OBGYN, okay? So 3 things. You should be getting a breast mammogram every year starting at 40, okay? Then you should be getting a pap smear starting at 21, and that is every 3 to 5 years. Of course, if it's abnormal, you may have to get it repeated a little more frequently, but that's the general cadence. And lastly, you should be getting a colonoscopy every 10 years starting at age 45. So they actually just brought down that age from 50 to 45 for everybody. So those are the 3 main things that you should be getting, whether it is through your OBGYN or through your general practitioner, your primary care doctor, it doesn't matter. But just remember, mammogram at 40, starting at 40 yearly, pap starting at 21 every 3 years, and colonoscopy every 10 years starting at 45. So those are my 3 main tips and tricks for really making sure that you are at optimal health. I hope you all have a wonderful Valentine's Day. Please subscribe to my YouTube channel, TheFibroidDoc, for more information. And of course, follow me on Instagram. Tag a friend who would find this information useful. Okay, bye everybody.